Have you ever been so focused on something that you're just not paying attention to your surroundings? We'll be talking about that and more in this episode of Interpreters and Interrupters. Hi, my name is Maritza. Like most medical interpreters, I follow my patients wherever they need to be. This may be a regular doctor's appointment, a procedure, or imaging like X-ray, MRIs, or CT scans. Recently, I was in radiology with a patient. The patient needed an MRI. MRI means magnetic resonance imaging. MRI machines use magnets and radiofrequency currents to produce detailed anatomical images. The magnetic force of an MRI machine is strong enough to fling a wheelchair across a room. The technicians were cleared, and so was the patient. No metals, no implanted metals inside the body. I wasn't. I was just going about my day. There goes the patient. I'm following right behind them, even though I saw the signs and I even read the signs. Luckily, the technicians were paying attention, and one of them held out their arm so that I wouldn't continue to walk inside the MRI imaging room. I was shaking. I couldn't believe that I took a step forward to enter the MRI room. Even scarier than that was that the New York Times reported July 17th that a man wearing a neck chain was pulled into an MRI machine. The man, who was 61, was wearing a large metallic chain around his neck when he entered the room at Nassau Open MRI, according to the Nassau County Police Department on Long Island. Sadly, this gentleman died the next day because of the injuries that he sustained. Whether you're a legal or a medical interpreter or a community interpreter, you need to pay attention of your surroundings. If you're a legal interpreter, before you go to your appointment, find out what you can and cannot bring. Are electronics allowed? Can you bring a backpack, a purse, or a tote? Can you bring beverages, especially for those of us that use metal containers like a metal water bottle? If you go to a factory, what do you need to bring? Do you need a safety vest, safety shoes? What's on the floor? What's around you? What's behind you? What's coming toward you? If you're a medical interpreter and you need to go to a procedure room, what's on the floor? What are you stepping on? What's behind you? Is there an automatic door that can open behind you and hit you? Are you standing in the way of the medical staff? So where do you stand? It depends. Who's in the room? How big is the room? Where is the person that you're interpreting for sitting or standing? Here's what I recommend. If you're interpreting in a courtroom, most of the time you'll be sitting next to a judge wearing a headset with a microphone. If you're sitting next to the defendant, plaintiff, or respondent, or a witness, you'll have to sit close to them, but not too close, and in a soft voice, do simultaneous interpreting, or maybe you can do consecutive interpreting and not have to sit too close. If you're in a jail or an attorney's office, you could sit next to the attorney facing the limited English speaker, or you could sit next to the limited English speaker, looking at the attorney. I like to sit next to the attorney. That way, the person can just look at me and the attorney at the same time, instead of having to turn their head to look at me and then turn their head again to look at their attorney. In a medical environment, you have doctor's appointments, and these can be done in an exam room or in a hospital room. I like to stand or sit next to the provider so that the patient can look at both of us at the same time. But sometimes the rooms are either too big or too small, and there's stuff everywhere if it's in a hospital room. There's usually a table, the bed, a sofa for visitors and family members, machines on stands, and all kinds of noises. There's beeping, alarms, oxygen tanks hissing. If the person needs to be examined by a medical provider, make sure to immediately stand behind a curtain. You want to give both the medical provider and the patient privacy. If there are no curtains, turn around. If you're doing community interpreting, again, sitting next to the person that speaks English, looking at the limited English speaker is probably the best setting for you as well. Sometimes People tell you, stand here, sit here, and that may not be the best positioning for you. So be assertive and let them know where you would prefer to sit or stand. Regardless of where you stand or sit, you want to keep the attention away from you as much as possible. Keep your voice volume loud enough to be heard, but not too loud where you're annoying. I've picked up a bad habit lately, and that is hand movements. When you're interpreting, you're not supposed to be moving your hands. Recently, when I was interpreting, and don't ask me why I did this because I never move my hands. It's just something that I started doing lately for some crazy reason. I put my hand to my throat. The patient was looking at me and she put her hand to her throat and asked, "Is there something wrong with my throat?" She read into that. In medical interpreting, sometimes you have to go to pulmonary function tests. The patient is sitting in a cabin with their mouth over a mouthpiece and clips over their nose and doing very intense breathing. Trust me, they're not going to be looking at the interpreter. That's why I stand next to the cabin. Sometimes the cabin door is closed, sometimes it's open. I stand facing the technician and as close to the cabin as possible, and I always ask the patient if they can hear me. The technician is doing hand movements to guide the patient through the different types of breathing that they have to do. For example, a wavy motion like this to indicate normal breathing. Other interpreters have told me that they do the hand movements too. You don't need two people doing all kinds of crazy hand movements. Could you imagine? You're the patient. You're trying to do this pulmonary function test and you have two people waving their hands and arms all over the place. Do not move your hands and your arms. There's no need for that. If you can't keep your arm and hand movements under control, sit on your hands or put your arms and your hands behind your back. I still can't figure out how I picked up this bad habit. If you like the content of this episode so far, please like or subscribe or download. It really helps the channel. I get a lot of questions regarding certification testing for legal or for medical. One of the top questions I get is, how do I prepare for a certification test? The number one advice that I can give you for preparing is study everyday words. It's those everyday words that are going to bite you every single time. I've taken the legal certification test in my state 2 times, and both times I have failed it by 2 or 3 points. Why? Because of an everyday word. The first time I failed my certification test was that during simultaneous, the word puzzle came up. Puzzle. I could not remember how to say puzzle in Spanish for the life of me. And they said it 3 times. When you can't remember a word, you can say a similar word, or you can explain what it is. What other word can I use to replace the word puzzle? I used the word image, and when it came up again, I used the word picture, but that is not anything like a puzzle, right? I was so devastated because I was doing so well. When I left the exam room and got in the elevator, as the elevator doors were closing, the word rompecabezas came to my head. It's not unusual to get tripped up by an everyday word. So here's my suggestion. When you're watching any kind of show, listen carefully. Figure out how would you interpret certain words. You may also find that there are words in the English language that don't have an exact translation in your language. For example, proofreading. There is no exact translation for proofreading in the Spanish language. Is there one for your language? Maybe, maybe not. So whenever someone says the word proofreading, which is not very often, thank goodness, I have to say in Spanish, when you check your writing to find out if there are any grammatical or spelling errors. I have to say all that, or maybe I can make it a little shorter, but I have to explain what it is because there's no word for proofreading. We can't predict what words will come up in a test unless somebody tells us, which is a big no-no, because when you take a certification test, whether it's legal or medical, you also sign a disclaimer saying that you will not tell others about the test. Thank you for joining me, and I'll see you next time here at Interpreters and Interrupters.